Don't attempt your morning commute without us. Ryan and Lisa, mornings on CFAX 1070.
Well, let's talk more about GLP-1s, often known by the brand name Ozempic, making waves in the health world for a while, and now Health Canada has approved not one but two generic versions for use in this country. What does this mean for people who already use the drugs or might sometime use the drugs? What do we need to know about this stuff? Here to talk about it, Dr. Tom Elliott is medical director with BC Diabetes. He's also a clinical associate professor at UBC. Sir, hello, how are you?
Good morning, Ryan.
Great to get you here. So first off, I guess just your initial thoughts on seeing the generic versions of Ozempic approved in Canada. What do you think about this news?
Well, the bottom line is that Ozempic, or generic Ozempic, is going to be cheaper, so it's a good thing. More competition, and as more and more of the generic manufacturers come on board, we could see prices drop down to 35% of the current Ozempic price, which would be around $3 a day, Ryan. So it's very, very good news for your listeners, for my patients on Ozempic, and for people who haven't been able to afford it as yet.
Now, you are with, of course, BC Diabetes, and that's where all of this started, right? These types of drugs were initially used for diabetes treatment and still are. Could you talk about how that works?
Well, yeah, the drugs were first identified as being indicated in diabetes and type 2 diabetes. You know, they increase insulin production, they suppress appetite, they delay the emptying of the stomach. So the net effect of that is lower sugar and lower weight. And then it was realized that these drugs caused weight loss in people who didn't have diabetes. So, you know, the class of drug now is widely used, not just for diabetes, but for obesity and overweight as well.
Now, with the drugs and its diabetes use, I guess let's just focus on that for a second. The generic versions, I gather, are going to help out there, or were people who use it for diabetes already covered by, healthcare plans, or how is the generic version going to change that end of it? And then we'll get to the weight loss part afterwards.
Okay. Well, that's a big question. I hope Josie Osborne, the Minister of Health, or her Chief of Staff, is listening, because Ryan, National Pharmacare came in for diabetes March 1st, and it covered all diabetes pills and biosimilar or generic insulins. The one thing it didn't cover from the first dollar was GLP-1s, represented in this province by Ozempic. And let's face it, it's based on price. So if multiple generic manufacturers can bring the price down to $3 a day, that's a level at which I think the drug should be covered from first dollar, so not subject to the deductible. Currently, Ozempic is covered by BC Pharmacare, but it's subject to the deductible, which means, take your net family income, which in BC is around $100K, subtract $13,700, leaving you about $87,000, and multiply that by 3%, and that's the average deductible in this province, around $2,400. So most British Columbian families have to spend $2,400 before they get a cent back. So I think that's going to change, and let's hope it does.
So even for folks,
otherwise people are paying out of pocket, and of course, the cheaper it is, the better it is.
So yeah, then I guess for folks who take this for diabetes, this is going to be a game changer, because the generic versions will let there be cheaper versions of this drug available. What do you think about the way it's gone beyond diabetes and to weight loss, where it's really making a splash, and has been for a long time? It's almost become sort of a bit more normalized that this is a drug people are taking. Weight loss is becoming this kind of weight loss is becoming a much more common thing. How do you feel about that?
I feel generally very good about it. We've never had treatments for obesity that are safe and effective and work for years. And now we have a class of drugs that are just fantastic. So, yes, of course, they are abused by people who don't need them, who are trying to squeeze into a dress or a suit from back in the day. But the vast majority of people on these drugs are on them for good reasons, and I think it's wonderful.
Are there side effects that are starting to show themselves with this being kind of a new thing in the grand scheme of things and now being widely adopted for all the reasons we've just talked about? Are there any concerns or cautions that we should be looking at?
Well, Ryan, I think it's fair to say that about 1 in 20 people who try this class of drugs, there's Ozempic for diabetes, there's Wegovy for obesity. They're both the same drug, semaglutide. There's Mounjaro for diabetes. There's Zepbound for obesity. That's another drug called tirzepatide. 1 in 20 people won't be able to take them because of nausea and vomiting. The other 19 might feel a little bit of something when they start, but the side effects will diminish and they'll do very well. So the only real caveat is that you might get nausea and vomiting. Some people get indigestion, some people get constipation. When you hear about other conditions, pancreatitis, gallstones, there's really very minimal linkage between those drugs and those conditions. There is one extraordinarily rare eye condition. It affects about 1 in 20,000 people, or is it 50,000 that might be linked to these drugs? So by and large, we're talking about a very safe and effective class of drug. And as you've just alluded, the price is going to drop dramatically in the next weeks and months.
And how do you access it here in BC? Like, is this something you have to be prescribed? How do you go about getting it?
Yeah, you ask your doctor for a prescription. Now, I should say that, that lifestyle therapy comes first, and it's always first. So that means healthy eating, not eating when you're sad, tired, lonely, bored, or anxious. Eating at meal times, putting food on the plate when the plate's empty, push away from the table. Healthy eating, reducing carbs in general, specifically white carbs, so white bread, white rice, white potato and stuff, filling up on beans and green vegetables, nuts and meat. And then exercise. So lifestyle is paramount, and it's first. And it's assumed that everybody who goes on these drugs is already on a sustainable lifestyle therapy.
Well, we got to leave it there, but it's fascinating as these things become ever more prevalent, these semaglutide drugs, and now we've got the generic versions coming out in Canada. Just an interesting conversation to have. Dr. Tom Elliott, he's with UBC. He's also a medical director with BC Diabetes. Fascinating conversation. Thank you so much for weighing in today.
Thanks a lot, Ryan.